Hello, welcome everybody to Coproduce Care. We're back again with our live streams, and it's October, it's Black History Month, and we are ready to be talking about race and equality and Black history in Black History Month. So we're really delighted to have a whole program that we're going to dedicate in October to talking to people who are doing some amazing things in the space of race really and social care. So hopefully we're not just going to talk about the statistics. We're going to talk about some soul food, what some people are doing within our local society, which is just fantastic. We can learn from, we can share with our colleagues. So we're doing something slightly different. And of course, we've been away for so long now. It's been probably over a month since we did our last live stream. But I am so excited to bring you some really exciting guests for our live streams. And we've got a little graphic here to give you a taster of who we've got coming up. So we'll be speaking to people from Skills for Care. If you work in social care, you'll know that. You'll know that organisation. Also, Shelagh Hetreed and Trisha Pereira, and two fantastic leaders really in this field who were also on the social care task force to talk about what we can do with supporting our BAME communities during COVID-19. And also we'll have in Bristol, we're based in Bristol, we'll have our local Deputy Mayor, Asher Craig, and also we've got some other guests coming up. So the best thing for you to do, because you never know when we're going to go live, is to subscribe and click the bell. If you click the bell, then you don't have to do anything else because you'll just be notified straight away when we go live. So that's if you're watching us on YouTube. And of course, if you're watching us anywhere else, if it's on Facebook or it's on Twitter, then make sure that you stay tuned with what we're doing, and we'll have some reminders up there for you shortly. So today is going to be really good. We're going to kick off with another local organisation, Nilaari. And we'll be speaking to someone who has done some great projects at Nilaari. We'll find out what Nilaari even means and what they do. And we're really looking forward to sharing some of that local knowledge, really. And people talk about the positive things that people do in organisations. And this is really one that I think has really lived and breathed what its aim and objective is. So without further ado, I'm going to introduce Shelagh, who's joining us today. Hello, Hi. Shelagh. Hi. Lovely to see you. Thanks so much. Thank you so much for joining us. You're welcome. So I think it would be really great if you could just give us an introduction into what you do with Nilaari and let us know who Nilaari is and how it came about.
Okay, well, Nilaari is a mental health service in Bristol in Stapleton Road, and it's actually celebrating, well, it's not celebrating because of what's gone on, its 21st year, serving the communities in Bristol. It was set up all that time ago by a group of BAME people, professionals, and Jean Smith has been the person who's led all the way through, our director. And there she is. It was because it was well acknowledged that people from BAME communities were not accessing mainstream services, and so it set out to be something different that people could learn to trust. And it survived and gone through all sorts of different sort of battles over the years, as any charity does, and is now strong and focused. And working through the pandemic. My role within that is I'm the business officer, and I deliver the training that we do, which is about unconscious bias. And the word Nilaari means to have self-worth and value. It's an African word, and we actually use quite a lot of African words in our organisation. So the training course is called Usawa, which means equalities in Swahili.
I was going to say which language. Beautiful. So why do you feel that people need to have that self-worth? Because it's a beautiful name. I love the inspiration that you've got from it. But I'm always intrigued to to know why you think that, why you even think that Jean thought it was necessary to create an organization like Nilaari.
Because of the lack of trust that was then. We're talking 21 years ago, and then when you talk now and you say how much has changed, sadly, BAME communities who needed support didn't know where to go, or their past experiences told them they would not get a service that was for them. They didn't feel invited. And so they stayed away from those services, and then their health diminished because of that. And so it's an organisation that starts by talking about trust and hope and respect and dignity, and that's our passwords. Before we do anything else, before we open our mouths about the reason somebody's come, it's the way that we actually will treat a person coming in, and that's what we are known for.
It's so interesting that you talk about trust and how important that trust is. And it's probably easier to get that trust because you're a local organisation, because you're based close to the communities that you want to support. You're not some outside national consultancy. And I was part of the task force advisory group that I'm going to talk about later on later in the month with Shelagh Hetreed and Trisha Pereira. And we were looking at how COVID was affecting different communities. And we had some meetings with people who were supporting just very locally, helping neighbours who were in the same Indian community, for example. And we talked to people who were carers and being supported, as well as those people who were being advocates. And they were saying, we were trying to establish, why do you feel like you have this relationship with someone that's really local? What makes it so special in comparison to other organizations? And they were saying it's because we really trust them. They know us, they know how we communicate, they know how we feel, they understand the area. And I think there's a real benefit to local organizations like Nilaari. Do you feel like you get the same sort of feedback?
Yes, we do. We sadly get people sometimes who come and say, I went to such and such, but I didn't feel they understood me. It's great. We can talk about rice and peas or whatever it is, that there's just that feeling of somebody who deeply understands the lifestyle and the ethnicity, the origin. We see people knock on our door. Well, they did. I keep saying we do, but they did until March when we had to close. And we'll always bring them in and, give them a cup of coffee and see what it is they need, and then see whether we can support them or refer them to somebody else, and maybe put them on a waiting list. So that's always something that we do, which I think other agencies maybe don't have the time to do. We seem to have time for people. We're not on a strict regime of see somebody in 50 minutes and then on to the next person. We give people time and we listen. And I think the listening bit is crucially important. Maybe we need more of that.
Absolutely. And talking about listening and different cultures and different ways of doing things and accepting people, what we're asking everybody who's coming onto our live streams in October is, of course, their inspiration for a person who's inspired them in Black history, because it is Black History Month. I wondered if you could share someone from your experiences, or someone you've heard about who's really inspired you from Black history.
Well, very recently, Black history is Princess Campbell, and who died, probably 6-7 years ago now, who I was lucky enough to work with. There she is. I was lucky enough to work with for 4 years. And I actually ended up speaking at her funeral, which was quite extraordinary, because I sort of saw her as a friend. And she was an extraordinary woman who had sort of fought all her life and overcome struggles of being Black in Bristol. And first of all, in getting a nurse's training, she started off in the tobacco factory, Will's Tobacco Factory, and everybody thought she was a princess because her name was Princess, so she had quite a reputation. She was the first Black person. And then after that, she trained as a nurse, and then she was overlooked for posts that she was most qualified for, and was apparently so popular that the rest of the ward said that's not fair, and they reconsidered, and she became the first black sister in Bristol. But that was her early career, and after that, she worked for organising housing for BAME people, for the elderly. She was a campaigner all the time. She was chair of several BAME elders groups. First of all, I think it was the Golden Ages, and then Malcolm X. And I went to see her a couple of days before she died. She died in Southmead Hospital, and she had the form to fill in to get the lunch, the funding for the Christmas lunch, which she did every year. And there was the form next to her. She was filling in that form. And I went to that Christmas lunch, and there was a space, as always, since she died, with a candle there instead of princess. So she was well loved. She was quite a sort of I don't know. She was a demanding woman. She got what she needed by her personality, and it worked. And I greatly admired her, and we had some very funny moments together. And she was great. Yeah.
That's absolutely wonderful. I mean, I can't believe you managed to meet her and know her and be that close to her. I think it's just an absolute blessing, really, and be inspired by her. We actually have a video of her talking, which we're going to show now.
The thing that drove me why I wanted to succeed to be a ward sister, I didn't like the sort of thing that was going on. As a black nurse, you'd be called to do the most trivial jobs. Washing bedpan, vomit bowls. You don't mind, but everybody should have a fair crack of the whip. And you're out there scrubbing and working. And I thought, this is not right. And I must change it. No, this is the activist in me, and I didn't even know. I said, this has got to change.
It's just beautiful, isn't it? You can just hear her passion in her voice. Even saying, this isn't right. This has got to change. I've got to do something about this. I'm not just going to take this. Yes. And it's that activism that she probably didn't even realize, that she said she's so humble, didn't realize she was being an activist, but she absolutely was, and just challenging people. And I think it's good to reflect back on those people who really have done it before and made inroads in areas that we now benefit from. But I suppose the whole question is, how far have we come? Like it is, I love the fact that we're talking about Black History Month. And I always have a difficulty with Black History Month because I think it's not just a month, but I do like the fact that we have a lot of focus on it, and children are learning more about it in school, so taking advantage of that. But also in your work, is there still quite a far way to go in terms of where we should be? Thinking about back in the 60s and 70s, there's so many movements to make the lives of today really a lot better, more equal. Have we come far enough in your opinion? Is there still quite a lot to do?
There's absolutely loads to do, and I think what I've been finding really since the lockdown, and since we've been doing a lot of Zoom meetings with a lot of organisations, mental health and health service and all other organisations, is that people are very keen, and of course Black Lives Matter has made a huge difference to people's awareness, and it's become an issue that people, I think more and more, I'm talking about white people, are thinking, what can we do? We've got to do something, this is terrible, what can we do? And then they ask that question, and then when you actually say what needs to be done, it's almost as though the answer is too big, and it needs to be broken down. And I think that for me is the report that came out about COVID. It all sort of is linked up in a horrible way. The report that came out about COVID and BAME being overrepresented in deaths and serious illness, and the bit that didn't come out, which was around the fact that it was around poverty and multiple housing and frontline workers and people not having the protection that they needed and having to work harder and being more used to being the person who just gets on with it and being expected to be that person, a whole plethora of things. That bit of the report didn't come out at first, and that is the bit that needs fixing, but it's almost too big. So I think there is just still loads to do. But I think Black Lives Matter has started off that. Really sad that here we are all this time, that it takes that to actually start people off thinking more and wanting to make changes, a real will among organisations to make things different. But it's just the getting there that's the tricky bit.
It's moving beyond being performative and just talking about change, because that's really fashionable at the moment.
Yeah,
talk about it. I know we're talking about it, but it's still good to reflect. But when you're in your own organisations, it's the action plan. I'm intrigued. What can you recall anything in particular where people say this is just too much? I'm not sure if I can do that, even though they agree with the concept. Are there any examples where you might suggest something or suggest a change within an organisation or the way they do things, and they just think, oh no, I can't do that?
It's not said. It's just the fact that the conversation sort of kind of, oh right, and it's like, well, tell me something else that I can do is what it feels like. I mean, I'm being brutally honest about the experience that I've had. Is like sort of or there is not enough evidence to say that will be the way forward, and I think the evidence is just the most. It's so huge. How can you have evidence of those inequalities and what people are going through? It's just, if people are not being asked, then you won't know, and people are not being asked. The research is not going in the directions that will actually give the answers that are needed. But everything is evidence-based, and I think this feels too sort of like, are you sure? Is that really what we need to do?
Yeah.
And it's about it is for me, it's so basic. It's about treating everybody with dignity, and just I use the term beginner's mind in my training, which is from mindfulness, but it's actually a Buddhist term. And I think it's the most, if only I could do it, never mind anybody else. And it's the idea, the concept that you start something or see something with a complete blank sheet in front of you. So it's just like, coming across something and not thinking, oh, that's one of those or one of that, or, oh yes, I've come across this before and it was like this. But just saying, okay, there's a person in front of me, they have a need. Let me just see what that need is and see whether I can help them, and get rid of all the stuff. The stereotypes, the experiences, and then that's literally what needs doing. But it's really hard for people who are stuck with their biases and don't even realise what they're doing, and their experiences that have influenced the way they feel about things. That it continues.
Absolutely, and it's that getting rid of the structures, everything we're taught, everything that we are told is normal. It's getting rid of what we've been learning and almost unlearn everything and just see something at face value. It's so much harder, I think, for people than it seems. The resistance, like you said, to even the Kevin Fenton report for Public Health England about the effect of COVID on BAME communities, and even the resistance to things like Black Lives Matter. And it's quite revealing, I think, the discussion that you see happening. But more locally, how do you see the pandemic affecting the communities that you support?
Well, I'm not a practitioner, but I've just done, in fact, it was the Mayor's blog on Saturday for World Health Day. I wrote that, which was a really nice, lovely opportunity. And so I asked some of our practitioners, what was going on for them. They're on the phone, and they're listening to people all the time. They've lost that ability to read people's faces and body language. And so I asked them what was happening. What I'm hearing is that, and I've heard it all the way through because I've been trying to keep a tally of what issues are coming up, is that people are frightened. Obviously, they're frightened of COVID, whether it's about worrying about infecting somebody that's close to them, or their own health, and this sort of nebulous that's not explained as to why. I heard the other day somebody on Radio 4, and I do trust Radio 4, saying, somebody asked them about the BAME issue, and they said diabetes, heart disease, and they mentioned a couple of other things, and being BAME. And I just thought, it almost sounds like it's a disease, and that's not what was meant. But it's like, okay, you can do something about taking medication for your heart disease and your diabetes, but it's just felt really strange to actually say and BAME without saying why and how. It's leaving people just frightened without knowing how to make themselves safe. The vitamin D rush, which I think still that it would be great if people understood about vitamin D. I mean, I immediately looked it all up and found loads of things out, and tried to tell people. And I have some friends who are actually Zimbabwean, who work in local hospitals, not in Bristol. And I went online to Amazon and bought as much vitamin D as I could, because I knew they wouldn't have time to do it. And every time I gave her a pot, which would last 9 months, she said, "Oh, well, I shared that among the other BAME nurses." So they just, it is, and they ran out. I mean, you couldn't get vitamin D.
What have you found out about vitamin D?
Well, certainly the whole thing about skin is that, and I think there's a real issue about people who are born in this country and people who have come maybe as an adult, as my Zimbabwean friends have, who haven't a clue that they need to have exposure to the sun in order to keep, to keep up their vitamin D levels. And vitamin D has all sorts of effects. I'm not sure it has anything. Nobody knows it has anything to do with whether COVID is affected by vitamin D levels, but it has loads of health benefits that are missing if you don't take it. And if only people were aware, I'm saying people who don't know, were aware that they need to be out between 11 and 3 with their arms and face uncovered, hopefully on the days when the sun is shining, then they will absorb the vitamin D. Now, isn't that a simple message for people to just not have to go out and buy a load of pills? But, if people don't know that, why would they know that? It's bizarre. But it's just those simple messages. But everybody jumped and bought the vitamin D tablets as much as they could, and they're really expensive. And I didn't hear anybody giving out the message that go out in the sun for, with your face and arms uncovered. So it's those sort of left without any reason. If I don't know how to keep myself safe, I don't know what to do.
Yeah.
I wear a face mask. In the beginning, I was wearing goggles because somebody who's a respiratory nurse told me that it was through your eyes as well. And it is, but I was wearing, industrial goggles and a face mask. And I would come home and wash the clothing I was wearing if I'd been to the supermarket. And we seem to have relaxed on some of those things now. But I was doing that and feeling that I could keep myself a bit safe. If there's added things that you don't know what they are, it's terrifying. And I think people are very worried, very nervous. A lot of people who were already our clients were not coming out, and they had no way of getting food because they weren't. The idea everybody was on everybody's list was certainly not the case, because who's on somebody's list to actually get something, and people won't ask. They're proud. They don't know whether it's them that's invited to have that, whether they're actually able to get things. So it was Jean and her son in the early days were actually going to supermarkets, standing in those long queues and taking bags of food to some of our clients who didn't come out but had absolutely no source of getting food. And those are, I can't use the word lucky ones, but there are loads of people who are not in touch with Nilaari in the city. I don't know whether they're still behind closed doors. I don't know what support they are getting or whose list that they're on. And it's a constant fear that there are people there who are completely isolated and still not getting help.
So we've put a lot of links at the bottom of the screen how people can get in touch with Nilaari. And before we move on to the kind of support that you can provide, obviously you're commissioned to do a certain amount of work, and obviously it would be great if you've got more commissioning to do more work. But before we get on to that, what do you feel, obviously you're aware of the report that Kevin Fenton did. I feel that there's a little bit of like silence. There's all these reports, countless reports. We've got reports coming out of our ears, eyes, everywhere. What do you feel that we need to do? You've obviously looked into like the issue with vitamin D. Would it be something that springs to mind to me is that could employers be offering vitamin D supplements to their non-white colleagues who are people of color? Any ideas that have come to mind to you from working with people, seeing what their difficulties are and also knowing what you know?
Oh gosh, I think from what I hear, there are people who it's all tied up with Black Lives Matter, because people's attitudes have changed, and I know for some it's wonderful because people are saying, I really want to support this, what can I do? Others are stuck in that dreadful kind of broken record of, well, I'm not white privileged, I'm not privileged, and there's a sort of backlash about that. So I think people need to be empathic of what their colleagues are going through or might be going through. It's not everybody. I'm not trying to generalize. With fears over their own health, and the insults that people get on the street. Certainly we've come across people who have had somebody coming up to them in the street and shouting into their face, you talk about white lives matter and all this sort of embarrassing nonsense as far as I'm concerned. Yeah, it is. I mean, that would be wonderful. And I have a feeling that some hospitals may already be doing that for their workers, is actually getting the vitamin D, because that's ongoing. That's something that's, an issue for life, isn't it, really?
Yeah.
And at the moment, people don't have the time, and they really need to be as fit as they can be. And understanding the issues of also, I know in one hospital that will remain nameless, the black staff felt that they were being asked, just like Princess, actually, when I listened to that clip, asked to do more than their white colleagues. That was their perception. And then being put into, there was a letter that went out saying that you shouldn't be near COVID patients to the BAME staff. And then managers saying, well, put on 2 lots of PPE, it'll be all right. So that kind of just acknowledging and realizing, and not trying to sort of persuade otherwise, that this is a huge and real issue for people. And just be there for them and with them, and be sensitive to something they might say, oh, no, I don't want to do that, or I don't feel I should be doing that, and not be told off or tutted at or feel guilty about saying no, because it's something they feel that they'll be put themselves in danger.
Absolutely. And I think these are conversations that we need to have, not only to help people get listened to, but also for organizations to realize that this is a duty that they are well within their rights to support, because I think sometimes as organization heads, they feel like they have to treat all staff the same, but that's not the same as treating all staff equally. If you've got a section of staff who are more at risk for whatever reason, and we've got this data, they quick fire done these very quick in-depth reports to give us the facts and the figures. People are well within their rights to go and say, I'm actually going to give extra support to these member of staff because of their health conditions, and lobby their funding authorities or even the government to say we need support to do this. Otherwise, it does feel like a very hostile environment that we're living in, we're working in, and that must do some horrible things to people's mental well-being. And of course, there's no end in sight for COVID, even if we might want to be positive about it and might like to think that there's going to be a vaccine soon. We have to work on the basis that this is going to be life as normal for quite a long time. So I really appreciate those insights, Shelagh. That was great. What about in terms of people wanting to get in touch with Nilaari? What at the moment support can you offer?
Well, we're getting waiting lists, which are growing, and we have the funding for one more person, and that person has arrived to be there. But yeah, I mean, it really is literally ringing up or looking at the website and seeing the email address, because that comes to me. It's Nilaari at Nilaari. What people get wrong is the AA, and then they can't find it. So it's because it's an African word. There's 2 letters, so it's Nilaari at Nilaari. But if you just Google our website, you'll find that, and an email will come to me, and I will then refer it on. And we're dealing with university staff as well as students. We've had a contract to work with BAME and overseas students for a couple of years now, and now it's also the staff, and it's the several other public sector. The workers are actually able to come and talk to us about whatever issues are there, and we will listen and support, and there can be several sessions if you need them, or we'll refer you on if there's somebody else that we feel is more appropriate.
So these are like coaching sessions, are they?
It's therapy, and it ranges from a CBT, cognitive behaviour therapy, which is talking therapies, that we can offer, not through the talking therapies that VitaHealth have the contract for, but we were doing that before them, and so we offer that type of therapy. CBT is a type of therapy, and it's where you actually learn how to deal with the issues in your life. So it's not particularly a counselling session where we listen to all your troubles. We do, but it's actually trying to encourage you to find ways of dealing with it. So it's changing the way your mind works so that you can cope with what life throws at you. And it does work. And people, come out the other end feeling that they're better able to cope, which is what we need. We need coping skills. Some people are traumatized because of what's happened. Some people have been traumatized for years over something else, and it's brought that trauma back. So we have people who have been thrown right back into something from a very long time ago, which may be completely unhealth related, and it's triggered something in them. So we have a lot of distressed people around. We have a lot of bereavement. We do bereavement counselling, but there are obviously professionals as well who are specifically able to work with that. But a lot of people are losing people. A lot of people have had terrifying experience with a relative who was near death, or is near death. So that there's just so much going on in the city, so much pain and so much difficulty. That I think is hitting BAME people all the time, more than other populations.
It feels so many things come to mind with what you said. Firstly, that there needs to be a lot of healing and recovery in order to reset almost for anything that comes going forward, which is exactly what you're doing. But also that it just seems so tragic that we need CBT to deal with the structures and the behaviors and just the way that we have to cope with our lives. It's incredible that you're having to help people to cope with terrible situations. It almost feels like the training or the sort of critical reflection needs to come for the top. You need people who are running organizations, who are doing even politics just differently, so that people don't have to go through this distress.
Yes.
But do you think that developing something for managers would be useful, as well as for people to cope within their workplace and their communities?
Yes, I'm sure somebody must be doing that, and we don't. I mean, I don't know who we have in our. We have a name. We don't think about sort of rank or anything else with somebody, but I'm sure we have people of all sorts of levels, if you like, of an organisation who are reaching out to us. But yes, wouldn't that be great for people to actually, and then to know how to support their own teams. And not be unaware completely of what's going on for lots of people. It would be fantastic.
So the support is there. You've got a waiting list, so people just need to be patient and but do get in touch. Definitely advocating for you guys to get more support, I think, because it's an amazing thing that you do. One thing I'm interested in is the terminology. So I use the words people of color, and sometimes I use non-white, mainly kind of tongue in cheek, just because of the whole, everything that you hear, whether it's prison stats, mental health, people in mental health hospitals, people, suffering from COVID, always seems because of the one fact that they aren't white. So it's not. So that's kind of how I use non-white. But you've got your preferred term of how you'd like to refer to yourself. And incidentally, you're also the only person who's not a person of color within Nilaari. Is that right?
We've got one more person. Yeah, we have another person, Charlotte. But yes, the rest are South Asian, African, Caribbean at the moment. We've had a lot of different. We try to be as diverse a team as we can. But I'm not English. I'm Irish, and that makes a huge difference to me.
Yeah.
Identity is something I work on. Absolutely.
Yeah. I love that. So everyone uses different terms, and it's interesting, the whole BAME thing that people use, but I'm personally not a huge fan of it because I mean, it's a different debate. But I just thought it was interesting that you were really kind of like mindful of that as well. Good. Okay. So in terms of where your organization is going, do you have any sort of future plans or future projects that you might be getting involved with?
Well, we've got, I mean, at the moment we have, and we usually get funding through charitable trusts for anything that we do. And we have funding which is usually 2 or 3 years, and then we have to start looking again. But at the moment we have Yellowbird, which has been going for about 2 or maybe possibly 3 years, 2 years, which is for over 25s BAME women and with complex needs. And that has been extraordinary. We did, here we go again, we did have, but actually we're contacting people by phone, a drop-in on a Thursday morning called Exhale, which you don't need to sign up for, you just knock on the door and come into it. And that's been extraordinarily successful for having an extraordinary range of different women. And they've very much become a group and I think support each other. And they're now being, as I say, contacted by phone. So that work is around, because we found probably 3 years ago or more that we had this, and we still don't know why, we had this, call it a phenomena of Black African women coming to Nilaari, finding their own way there or being referred in large quantities. And we had no specific funding for working with BAME women at that time. So that's why we set this up. We also have Bluebird, which is for under 25s, which until lockdown was working in some of the colleges and sixth forms with BAME young women as a group. And then people could come and young women could come and say, could they have one-to-one sessions if they felt the need. So we had that going. We have Jabari, which is for men, which includes men with offending histories. So it's for complex men. So yeah, that's going as well. We have 2 men who are covering that now. And then we just, literally the day of lockdown, we'd just taken on Charlotte. And she was to do a project which I got the funding for from Bristol City Council, which is called Weaverbird. And it's called Weaverbird because if you know anything about weaver birds, they actually weave their nests together. So each nest they make, they will attach almost like sewing to another nest, and you end up with a city of weaverbird nests together. So I thought that was wonderful. And I've seen weaverbirds when I've been abroad and absolutely love them. So it's called Weaverbird, and it's working with new community women where they are, usually sort of children's centres or wherever they are, dropping off their children or wherever they're actually already going to as a group, to work with them about the whole issue of learning to trust each other and to break down the barriers, sometimes the stigma of having mental health in the family, and the fact that people don't share that information among the community because of the adverse reaction sometimes to it. So it's really working with young women to break that down. And I think Charlotte's just sort of putting a toe out the door now to make those contacts 6 months on. She's been on the phone with everybody else, being a general therapist with us. And in fact, I've been talking to Bluebird, who are really interested. Bluebird is the prenatal, postnatal mental health charity in Bristol, about maybe finding a way of linking up so that people are getting informed, BAME people are being informed about the support there because of their underrepresentation. They're really keen to improve the representation of BAME mums to be and fathers to be and mums and fathers after the birth. So it's like things are linking up. You start one thing and you suddenly see that other organisations can link up with that in some way. And so we've got the Weaverbird project as well. And then I do Yasawa, as I say, which is the Equalities in Swahili, which I've been doing for 3 years. And that's a one-day course about unconscious bias and working with difference. And those two things go very much together about, that I'm an older white woman, which has an impact on a younger black person who might be in front of me. They're going to be thinking, oh, Lord, what's she going to know at her age? Oh, no, she's white, etc., etc. And vice versa, I might think, oh, Lord, I've got a black person in front of me. I don't know anything about black people, etc., etc. So it's a two-way process, is working with difference. It's not about me as a white person working with a black person. It's actually realizing that whoever you are, your whole being is impacting on the person in front of you if you have a client.
And who's that training open to?
It's open to I call it teams. So it's teams from voluntary or statutory organisations, and it's just literally tomorrow starting as the first webinar. Terrifying, changing what was a very interactive course with people in small groups and card shuffling and everything else to try and make that into an interactive webinar, and with very limited options for doing that. And I also do a multi-agency one every now and again, which is for one person from an organisation paying to come on it for their organisation because they're interested or the organisation wants them to lead. So we do it both ways. So we have lots of different people from different organisations in one course, or we have a whole team or a whole management coming together for a whole day.
I'm interested in that training, and I feel like that's something that a lot of, because I was talking about organizations getting that type of training, and I don't even like to call it a training because you think that
that's the wrong word.
Health, it is the wrong word, because you think with health and safety training or with first aid training, you then know how to do save someone's life. With unconscious bias training, it's not really training, it's almost a reflection again on how we cope with what we've learned in our society and our structures, and trying to examine how we react to others and how that might feel. So it's almost like what you do in terms of that coaching and support and CBT, but you're doing it to help people understand how their actions affect others in their interactions with other people who are different from them. So
I actually use the CBT model as part of the day because it fits so well. I mean, if I just tell you that the basic CBT model, if anybody goes to talking therapies, the first thing they'll be told is about the fact that you have a thought, and that thought brings a feeling. Sorry, that thought brings a feeling. The feeling brings an emotional reaction, and the emotional reaction brings an action. And that is the basis. It's very difficult to say it. It's much better to see it as a diagram. But just that, and I apply it to something like the killing of George Floyd. If you think of a thought leading to a feeling, the feeling leading to an emotional reaction, and then an action as a result of that, it to me, says loads about what is happening all the time. About police stopping cars, etc., 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 and a non-cooperative BAME person in the car saying, no, I'm not getting out, etc., etc. It's part of the same model of, the thought, the injustice, etc., etc. So I think I use that model as to understand what's going on, and to try and, just like CBT, try and change. You've got the thought, but then you change the emotional reaction and you change the action at the end of it.
That's a beautiful way of looking at it. I don't know anything about CBT, but it just, in everything that I'm reading and looking at the moment, it makes absolute sense to look at it from that point of view. And it's actually really helpful in terms of judging ourselves on how we end up doing what we do, where it comes from. And I think even moving back from the thought of, why am I having this thought? What is it within my experience, my upbringing, my education, what I like to, who I follow on Twitter, that's made me even have that thought? Because, like we said earlier, everyone will see an injustice or see something on the news and will think of it and view it in totally opposed ways. So it's such a good thing that you're doing with getting people to reevaluate why they've come to that thought and what consequences that has. I think it's something that we all should be doing in all of our organizations, to be honest. So definitely people get in touch, and presumably there's no waiting list for that.
But it's just me, so that's the waiting list, is that that I'm doing it apart from my work. So it's it'll get they'll be booked in as I can manage them.
How are you finding the interactions with people from doing things like this compared to, I get the feeling that you much prefer that face-to-face interaction with people than doing things on a screen. Do you feel that affects the efficacy of the work that you do?
Yes, I think it has to. And I've been I started off my interest in training was back in the dare I say it, in the mid and late 80s, when I was the advisor for drugs education for Avon County. I was a teacher, and I was brought out for 4 years to teach drugs education to teachers because it had never been done before. They decided to introduce it, and I learned to be a trainer, and it was called active learning at that time. And it's actually where you don't sit and be lectured to with a chalkboard or whatever it was at the time, PowerPoint in front of you, but you actually get into small groups, you discuss things, and then you bring back what you've discussed. That for me is the only way. I think people who sit in front of a screen or at a lecture theatre in a university, who just have a load of words put in front of them and somebody speaking for a very long time. We know our concentration span, the theory of concentration span is way less than those lectures. So I believe in engaging people. They're teaching themselves. I don't teach them anything on the course. I just get them to talk. I trigger them with photographs or words, and then off they go and discuss it, and then come to their own conclusions. And maybe I'll just question, so what do you think now? And they usually find that they've changed. So yeah, I'm a great advocate for kind of face-to-face and not telling people, but asking them, and challenging gently is the way I put it. Gentle challenge.
That's brilliant, and it's very holistic. Your approach, and it's fantastic. I always want to book myself on a course, even though I probably don't need to.
Be daunting.
Yeah, well, I just feel like it would be really wholesome and just lovely to have those discussions. And like I said, I think there's a place for it in every organization, and just not as a tick box, but something that's really food for the soul, and that really does help people to relate better to each other and have more compassion. So that was a really fantastic discussion, Sheila. I don't think we've got any comment that I've not picked up at the moment. No, people are just listening intently to what you're saying. So I'll just encourage people to get in touch, maybe get on the waiting list if they need to, or even just engage with the training. I think that's really good. Obviously, you'll be planning those throughout the year, but it just seems like a good time as we're looking at things changing again and going back to how they were. Hopefully not as bad, but just to take stock of how we're supporting people who have the worst outcomes in this pandemic. So huge thank you for all the work that you're doing. I'm really a big fan, and thank you for joining us today. So I will let you go, but thank you very much, Sheila.
Well, thank you for listening and having me. And as a white person, as a a non-black person, as I say.
Yeah, that's it. That was the term you used, wasn't it?
Yeah.
Lovely. Okay, thanks very much. Take care, Sheila.
Okay. Bye-bye.
So that was Sheila there from Nilaari. I hope that you found that really interesting. I did. I learned a lot. I learned about the talking therapies and CBT, and how actually they're really useful for how we have discussions with people, how we engage and support people through this pandemic, but also the reflections of the amazing things that Princess Campbell did, and her influence, and how whatever she did not very long ago is actually really, really relevant now, and how much of an activist she was in that area. And of course, nursing is close to social care. So very, really interesting, and absolutely do share this stream, watch it back, take clips from it. And of course, we're going to have a lot more speakers again throughout October, like I said. So the best thing you can do if you're on Facebook, then just like our page, and get a reminder. You can find out what all of the streams are going to be on our pages now. We've put them all up on our YouTube, so they're all schedules. You can set a reminder, and you'll just get a reminder when we go live, so you don't even have to worry about it. But slightly outside of Black History Month, we are having one live stream which is specific for care providers, people who are supported in social care, and that is one that we're going to have next week, because CQC, the Care Quality Commissioner, the people who regulate social care, they are releasing a report, hopefully this Friday. Don't quote me on it, but we're hoping it is going to be this Friday, the 16th of October. And they do this report on the state of care, adult social care, every year around the same time in the autumn. This time, we don't want any report like that to sort of be released and then nothing happens with it and just gathers dust. We're going to really dig down into the issues that are raised by that report. Typically, they bring up good examples of good practice. They bring up issues that the sector is struggling with. And I think this is going to be a really important report because it's going to reflect back on that period of COVID-19 that we've had in the last 6 to 7 months. So I presume it will. I don't know the exact dates, but it's definitely going to cover some of it. So we've asked Kate Tironi, who's heads up the CQC for adult social care. She's going to come on. She's spoken to us before, and she'll be doing about half an hour talking about the report, and she'll be answering your questions. So very much recommend that you log into that call and you subscribe and you watch, because I don't know any other time that even I'd be able to ask Kate Tironi direct questions about the state of care report. So definitely share with people who are interested in social care, who work in social care, and just make sure that we get as many people on the stream as possible, because it's a great opportunity. But we're not going to leave it there. You'll also get an opportunity to pre-record questions that you have for Kate. So if you follow us on Twitter, all the details of the number you need to text your questions to, or film yourself asking her a question, and we'll pop it up on the screen like we've done before. And then lastly, we're going to have a fantastic panel of people to discuss the report on top of that. So it's a real forensic deep dive into issues that have been faced by adult social care over the last 12 months. So this is a graphic of the people who we'll be talking with. Got someone's face covered there. There we are. So Mark Tops, some of you will know Mark. He's been a fantastic advocate of social care and the issues faced, especially for people who are being supported with learning disabilities. Vic Rayner, who's Chief Executive of the National Care Forum. Melanie Weatherly, I've never spoken with her before, so I'm really excited to have her on, because she is not only Chief Executive at Walnut Care, but also involved with the Care Providers Association. So she'll explain what that association is when she's on. Jonathan Cunningham, who we've had before, Jane Townsend, and also Nicholas Kemew, who is care manager at Oakland Care, and they do some fantastic practice there. So a really good panel. I'm really looking forward to this one. Like I said, it's outside of the whole theme of Black History Month, Colour of Care, #Colour of Care live streams that we're having at the moment. But actually, I might ask people about who inspires them in Black history. If we get time, there's going to be so much packed into that. But I think that would be interesting, considering what month we're in. But like I said before, just subscribe, like us, follow us, and get involved, and keep up to date with what we're doing, because it really is some fantastic things that we're looking at doing. And if you've got any questions, then you can tweet us, you can email us. Just keep in touch with what we're doing, and we very much look forward to speaking with you with your comments next week with Kate Tironi and other fantastic speakers that we will have next week. So tune in, keep involved, and we'll see you next week. Take care, everyone.